Facelift tightness. What procedures help to maintain tightness of a facelift? What procedures help to maintain tightness of a facelift? Will Vampire Facial PRP do this? Thanks.
Thank you for your question. You submitted your question without a photo, but in your question you're basically asking, how do you maintain the tightness of a facelift? And does the Vampire Facelift or Vampire Facial have a potential role in maintaining this tightness? Well, I can certainly share with you my guidance to my patients about this concept of maintaining the results after a facelift. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facelifts have been a very significant part of my practice in my 20 years, as well as other non-surgical procedures such as structural volumizing, injectable fillers, and things like that to help people with facial aging. In fact, this has been a significant focus of my practice, and there's been a continuous evolution in the strategies of helping people with facial aging and addressing this very concept of maintenance and whether tightness actually is the objective. So to begin with, it's important to understand that facial aging is not just about skin getting loose over a structure that remains the same. In fact, facial aging is a progression of bone loss, muscle and fat loss, changing of this dimension of the very structure and foundation of the face, as well as weakening and stretching and changes in the quality and elasticity of the tissue. So before there were injectable fillers to the level that we have right now, essentially the gold standard of cosmetic surgery for facial aging was, of course, the facelift. And I recall how we were all, as surgeons, trying to unlock the secret to maximizing the longevity of a facelift procedure. And it became almost a race to who can do more aggressive, quote, deeper types of surgeries, a term that's used frequently, such as deep plane. And it was all with the intention to try to maximize the longevity, because the challenge was that as good as people can look right after a facelift, depending on their age, skin type, degree of change, there was always a certain amount of regression or laxity. So when it comes to understanding what is maximizing one's appearance, it is always about a balance of volume and tone of the skin when it comes to looking natural. One of the things that people objected to, particularly in the mid to late 90s, was that in places like the Upper East Side of Manhattan, people of significant wealth would walk around looking very tight and very pulled. And some of the best surgeons in the world were doing this, and yet for some reason they didn't look young. And the reason is very straightforward. In principle, a youthful face is not a pulled and tight face. A youthful face has balance, it has volume, and the last thing a youthful face looks like is someone who's pulled. So it's been my observation and my conclusion at this point that for people who we used to steer towards facelifting surgery, let's say people in their mid-40s to mid to late 50s, these patients have now, because of this better understanding of the issues with volume loss, many of those patients I actually steer towards structural volumizing. Structural volumizing is a method of using a long-lasting filler, such as a Juvederm Ultra Plus or a Juvederm Voluma, and placing it at the bone structure level to help restore volume and essentially creating the desired appearance of a facelift. And in fact, because volume is being restored, I would argue that many a times these results actually look much better than a facelift. When a facelift is being done, we're restoring tissue that is sagging, and we are making the underlying structure more defined. However, if there is a volume deficit in the underlying structure, then there is still an opportunity to make that difference. Now, of course, at a certain point when there is significant jowling, when there's significant laxity of the skin of the neck and loss of volume or the position of this soft tissue, then a face and neck lift procedure is appropriate. Once that's done, yes, it's important to think about how to maintain that as long as possible. So the goal is to maximize the quality of the tissue so that the acceleration of any aging process through other variables is diminished. So of course, protecting the skin from excess sun exposure, avoiding smoking, and proper diet, exercise. Basically, what's good for your health is good for your skin. However, the aging process does march on. So what I've also concluded at a certain point after the facelifting surgery, in the past when someone would be reaching that point, anywhere from 5 to 10 years after a facelift, where they feel like they're ready for their next facelift, I find that structural volumizing can actually be a substitution for another facelift, because the volume loss, in my opinion and my observation, is more significant a factor than it is about sagging. And people are learning to realize that the, quote, sagging is because the underlying structure is diminishing. So then our friends, the injectable fillers, can actually play a very important role. So it is often said that an ounce of prevention is worth more than a pound of cure. So if you can, of course, avoid those factors that can cause your tissue to age more and employ other strategies to restore volume, then you will achieve more likely what is the true objective of a facelift. Objective of facelift typically is to improve the jawline, to improve the cheek position, to restore some definition, to restore proportion, the golden ratio of the upper face to the lower face, and various other relationships. So basically learn about this type of concept and do everything that you can to take good care of yourself, and and yes, PRP can play a role in improving and maximizing skin quality, but the skin is only 2 millimeters in thickness, and below that skin is a layer of fat, which also can benefit from PRP, and that can help complement this idea of improving and maximizing skin quality through prevention and through certain types of regenerative technology for maintenance. There's a value in that, but it doesn't mean that your bone structure and everything else will not continue to age. But essentially, it's about maintenance. So I hope that was helpful. I wish you the best of luck. Thank you for your question.